views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello, welcome to Open, the one and only show that opens the Bronx and the rest of the world right to you. I'm your host, Daren Jaime. Today we'll update you on what's happening in and around our borough as well as New York City. Coming up, we'll bring you the latest as we continue to update the news regarding the coronavirus pandemic. And then the attorney and host of today's verdict, David Lesch, will join us. He'll talk about how the coronavirus is affecting those in the legal community. And then afterwards, we'll speak to New York State Senator of the 34th District, Alessandra Biaggi. She'll share a little bit about the initiatives being taken, how hospitals in our area are dealing with the COVID-19 virus, as well as those being affected. And then we're also going to speak to the council member of District 11. That's Andrew Cohen. He's going to give us an update as to what's happening in his community. And then also we'll go to District 12 for Councilmember Andy King. He shares a little bit about what's going on in his district, as well as what young people are doing with regards to the COVID-19 virus and their reaction to that as well. And then we're also going to introduce you to a company that's dedicated to serving the greater New York City community with online learning, digital consulting, as well as media. And then we're also going to introduce you to a local business that's taking the initiative of actually giving back in the wake of COVID-19 and having no employees. So stay tuned, because all this and much more is heading your way, because right now we're officially open. Hello, everyone. I'm Daren Jaime, and today is Wednesday, April the 1st. And of course, you're watching Open, a live interactive program that brings the Bronx and New York City straight to you. We also want to welcome our viewers on Manhattan Neighborhood Network. This Open is now being broadcast live simultaneously on our M&N's channels. Now, you can stay connected to us also via social media on all of our streaming platforms. That includes Facebook, Twitter, Instagram. All you have to do is stay connected to BronxNet Television, and you'll get the latest as well. Proud to be able to come to you in this virtual format, bringing you news, information, and the content that you need to know. And even though our method has changed, the message still remains the same, getting the content out to you so that way you can be better informed. A lot has been going on throughout the course of this past week, and now we're going to take you through it with some Bronx updates. And now more with developing news in regards to the coronavirus. There are over 30,000 confirmed cases in New York City and more than 1,000 deaths being reported due to coronavirus. The governor, Andrew Cohen, has announced New York State shutdown. It'll be extended at least 2 more weeks in efforts to fight the spread of the coronavirus. The governor also issued an executive order, quote, to put New York on pause, an acronym for Policies Assure Uniform Safety in Everyone. That's been extended to April 15th. All non-essential workers should stay home. Schools will remain closed and all large gatherings will be banned until that date. The governor stated that the pause order will be reevaluated every 2 weeks going forward. The measures the state is taking to expand its hospital's capacity, with both the Javits Center and Manhattan opening its 1,000-bed makeshift hospital, and the 1,000-bed USNS Comfort also arrived in New York City on Monday. Well, during this pandemic, many former substance abusers are not able to receive the adequate treatment because of COVID-19. Our BronxNet reporter, Darissa White, brings us the story.
It's been weeks since President Trump declared a national emergency in response to the spread of COVID-19.
I am officially declaring a national emergency. Two very big words.
In that time, we've seen the world as we know it shut down, as we're forced to isolate ourselves. For some, isolation can be daunting, but something you can adjust to. But for others, like people with a history of substance and opioid use, isolation can mean life or death.
If you're a drug user and you're isolated at home, you have several problems. One of them is you may go into drug withdrawal if you can't get your drugs.
Dr. Samuel Friedman is a research professor at the NYU School of Medicine, Department of Population Health. He says isolation will drive some drug users to extreme lengths to prevent the side effects of withdrawal, which can ultimately expose them to the novel coronavirus.
Some of them may end up getting arrested, in which case they're going to both be in withdrawal, and unless something's done to the jails and prison, they're going to be in horrible risk for coronavirus, because those things are going to be like nursing homes. Some of them already are.
According to a 2018 study on rats published by the National Institute on Drug Abuse, when given the option to interact with other rats or ingest heroin or methamphetamine, quote, the rats consistently chose the social reward. Another concern for drug users besides isolation during COVID-19 is receiving adequate care. Dr. Friedman says some are homeless and are unable to gain access to clean syringes or naloxone in the event of an overdose because of a shortage of medical personnel.
The more serious problem is all those people they have no protective equipment at the moment, and they are burning out.
The Substance Abuse and Mental Health Administration released a statement urging many outpatient treatment centers to use telehealth and telephonic services. Mary Callahan, Senior Director of Outpatient Services for Odyssey House, says her treatment center, along with many others, are using telehealth in the interim to prescribe Suboxone, a drug which diminishes the effects of physical dependence to opioids, such as withdrawal symptoms and cravings.
Someone who has previously been prescribed and we can confirm the prescription online, so the doctor has the ability to do that, also already prescribed it, we are continuing to prescribe our patients.
Callahan also suggests for drug users not to isolate yourself completely during this time. Instead, reach out to support hotlines such as theirs. Reporting for BronxNet, Darissa White.
And thank you, Darissa. In other news, a field hospital is being built in Central Park's East Meadow, and that's to expand Mount Sinai Hospital's capacity as New York City hospitals are grappling with patients coming in sick with coronavirus. Mount Sinai is building the 68-bed facility with the help of a North Carolina-based evangelical group called Samaritan's Purse. The Central Park Field Hospital is the latest example of efforts to expand hospital capacity at Mount Sinai and at hospitals throughout New York City. Mount Sinai is also repurposing lobbies as well as other public spaces at its Upper East Side flagship into patient pods that can be up and running in the coming weeks. City parks are also in the mix. City parks such as Central Park have not been shut down, and city and state officers are encouraging New Yorkers just adhere to social distancing measures implemented to combat the spread of the coronavirus. Mayor Bill de Blasio stated during his Sunday briefing that fines will be $250 and $500 that could be given to people who show blatant disregard to social distancing efforts and ignore police officers who attempt to remind people of following distancing rules. Well, stay with us because BronxNet will continue its ongoing coverage of coronavirus 19 and how it's affecting the Bronx and New York City. Coming up after the break, we're going to talk with some elected officials to find out with boots on the ground how they're dealing with COVID-19. That and more on Open right after this.
It's time to get serious about your future. At Bronx Community College, you can earn an Associate of Applied Science degree and become a medical laboratory technician in as little as 2 years. Earn an average salary of over $50,000 a year in one of the most rewarding careers in medicine. All you need is a high school diploma or equivalent to get started. Those who qualify can get tuition covered by grants and scholarships, so why wait? For program details, contact Bronx Community College today.
And we're back here on Open. Daren Jaime here with you, and we continue to bring you the news, the information, and the content that you need to know, particularly for a time such as this. As COVID-19 continues to wreak havoc across New York City, as numbers continue to rise, and as we continue to get towards the curve, it's our commitment to try to bring you as much news and information and content to keep you informed. And so we have various segments here on Open, and one is always our legal segment. And my friend, my brother, David Lesch, who is also an attorney and host of Today's Verdict, joins us now on Open to share a little bit. And David, good to have you.
Always good to see you, Darren. Darren, look, I'm not wearing a tie. Probably the first time you've ever seen me ever without a tie.
Well, look, we both got the look, brother. So I mean, it's that way, and given the fact of what's going on right now, I think a lot of us are making adjustments and making modifications. Yeah. But talk to me about, from a legal perspective, you're a lawyer, right? And you're practicing law, but even you've been upended in this. What kind of adjustments have you had to make?
So let me tell you what we did. Right now, I'm in my apartment in Manhattan. Basically confined here, which like most of us are. What my brother and I decided to do, my law partner of Lesch and Lesch, is we decided when it really got bad a couple of weeks ago that we were going to have a meeting with the staff, and we were going to address the staff in such a way that we were going to try to keep everybody on payroll. We had 8 employees in my office, that we were going to keep everybody going. We were not going to cut anybody's salary or anyone's payroll for as long as we possibly could. And to do that, we implemented a few rules so at least we could do this. And we set up our office in such a way, and then I'll explain to you how that impacts the court system as well. What we decided to do was we were going to have 3 meetings a day, 3 Zoom meetings, one at 9:15, one at 1 o'clock, and one at 4:45. All 8 people would be on camera at the same time. And what we would be discussing is the tasks that everybody would be doing during the day to make sure that the office was running. Well, what type of tasks? Well, basically, my practice involves personal injury, when people are involved in accidents, medical malpractice, when you're injured, unfortunately, at the hands of a physician, as well as, sometimes we have real estate deals and estate deals. Well, we have a system in my office called Cloud Lex. It's a software system. It allows everybody to work remotely through a server, and everybody can see what everybody else is doing. We also, believe it or not, which is important, we can tell how long somebody's been actually working on a particular task. So you can find out and you can see how much people are working based on how long they've logged into the system. So let's say we had an accident case which we've been working on. Maybe we can't go to court on it, but that doesn't mean we still can't work on it.
Right.
Defendants will say, hey, we want discovery. We want the medical records of your client. We want photos of the injury. We want accident reports, police reports. We want you to keep working on this, Mr. Lesch. So we don't have a problem with that either. So we'll have somebody log into the system, get all these documents, then forward it on to the defendant's office remotely through email. And this way, back and forth, we can decide what is or what is not being done on a particular case. Now, here's the thing. As attorneys, you have certain time limits that you need to present these things through discovery. Usually, we will file our responses with the court in terms of what's called an e-file system that the Office of Court Administration has created. Because the Office of Court Administration does not want to be backed up with so much work, they've asked the attorneys to no longer e-file, which means whatever we're doing with attorneys now is just between both of us, or among the three of us.
No court involvement.
No court involved. So now you might say, well, David, what happens if you have, I don't know, a statute of limitations that something has to be filed within 3 years and you're up to the last day? Well, you can't do it. You can't file it e-file. You just have to hope that the court will look at it later on and say, okay, you filed within your requisite time, 30 days, 60 days, 120 days. Remember, law is all about time limits.
Right.
And hopefully they'll look back and they'll say, okay, Mr. Lesch, you did do it within that time. You may not have e-filed it, but we asked you not to, but we're going to look at it in the past and say, fine, not a problem. So what we've been doing as a law office has been acting as if nothing has changed, sending out the discovery responses, making sure that the attorneys get it on the other side. And then if they get it, hopefully they'll review it and say, this is insufficient or sufficient, and we'll work that way. Now you might say to me, well, what else can you do? Well, my practice involves depositions. That's where you're asked questions. Your client is asked questions with a lawyer next to you. Well, believe it or not, we're still doing that. We have in-camera depositions, just the way you and I are talking right now on Zoom.
Right.
We can have situations with a court reporter, so long as everybody agrees that the court reporter does not have to be present in a room, we will go forward. So let's say you were the client, okay, and I was representing you. I could represent you in this way, and we would have in another box the court reporter who was taking this all down.
Right.
And eventually this would be all transcribed into a transcript, sent in an email for you to read it later on, to give an email signature, and we could do it that way. So it doesn't prevent the law office from running. It just makes it a little bit harder. Now, let's say
let me ask you this, because you're talking about the law office run, and let's take that example. You've got that, you've done everything that you're supposed to do. Now, we got to wait for a court date. We don't know when this is going to end, right? What's going to happen? And what do you think in terms of time frame for,
well, that's a good question. Right. That's a good question, because right now we've gotten the directive from the chief judge that everything is shut down in terms of attorney appearances. The only thing that's going on in the courthouse across the street from my office is emergency applications. All right. Those are applications for guardianship, let's say, illegal lockouts. Somebody's locked out of their apartment illegally. These types of things, medical decisions, immediate medical decisions. That's why the administrative judge is still in the courthouse now, with court officers who are risking their lives, who are there right now. So it is open just for emergency applications. But the garden variety attorney like myself, we won't be going back and forth conferences with attorneys. So what do I think is going to happen when everything starts to resolve itself, which hopefully would be sometime in maybe June or July? Well, you certainly don't want 50 to 60 lawyers in a courtroom like we have every single day, mornings and afternoons. You're still going to want some type of separation, even when this does calm down. I see in the future some type of video conferencing that's going to happen. I can't imagine the court attorneys who conference each case are going to want to have 3 attorneys at a time, one after another, coming over. I assume there's going to be a video conferencing. I also think maybe they'll limit the amount of attorneys that are allowed in a courtroom at a time, maybe 5, maybe 10. But you have to understand, Daren, there are so many cases in the Bronx courthouse that it's going to be very difficult to limit it to 10 attorneys at a time. I don't think you understand just how many attorneys are in a courtroom every morning. And this is one courtroom. There'll be 60 attorneys in a courtroom. And that's one courtroom out of 5 courtrooms that have the 60 attorneys in it. It's a constant rotation that goes on. So that's what I think is going to happen. My brother and I are still calling up insurance companies and adjusters to settle cases now. And you might think, well, why would that happen? Well, the insurance adjusters want to justify why they're still getting paid. They have supervisors. So if the insurance adjusters can move a case and can settle a case on the phone for whatever amount that is, and I can get my client on the phone to agree, well, we've just settled a case. And we did that last week. 3 to 4 cases every couple of days we've been able to settle. Everybody wants the wheel to keep running. Now, here's an issue, though. Money. Everybody needs money at this point. Right. The problem is getting the check to come into the mail. Well, who's going to get the mail? You got to go into an office. You want to be careful about going into an office. And then remember, with a check, the client has to endorse the check. It has to be signed in the back of the check. Right. Because the checks usually come with a lawyer and the client together. So I need either permission from the attorney, from the client, to sign the back of the check, but I still have to get to a bank to deposit the check. And I still have to write the client a check, and I still have to mail it to the client. These things can be done, and we're doing these things, but it's just not easy. So the small office like mine with 8 employees, we also have a group in the Philippines that we work with as well, but these 8 employees, this Bronx family law firm is adjusting without laying people off, which is not an easy thing to do, but that's how we're doing.
Yeah, not easy. Well, Dave, we got to leave it there because that's our segment, but definitely wanted to get a perspective on exactly how it is for lawyers coping with coronavirus. And you gave us a very in-depth description. And I think we got a better understanding as how it is for the legal system. Thanks so much. And
absolutely. You stay safe, Daren. Hey, and next time we talk next week, I'll give you a little bit of update of what's going on in the legal world. Maybe we'll talk about specific laws. How's that?
We'll do that. All right. David Lesch, our guest here on Open. Stay with us. We got more show coming up right after this.
We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Here on Open, Daren Jaime here with you. And as we're talking about COVID-19, how the Bronx and New York City is reacting and dealing as COVID-19 continues to wreak havoc upon our everyday life, how we do business, and really how we actually function from here. It's going to be a long time from what has been perceived as normalcy. But what we've been doing is we've been providing you virtual content, talking to some of the key players, getting you connected with people so that you can actually know exactly what's going on in and around our borough. Pleased to be joined by the New York State Senator of the 34th Assembly District, Ms. Alessandra Biaggi. And we thank you so much for being with us. How are you?
I'm doing great, Daren. Thank you for having me on. And also, by the way, thank you. I want to commend you for doing this and bringing information virtually because you pivoted, and that's exactly what is needed at this time, to be flexible, to be able to deliver the news.
Well, I tell you, everybody's got to pivot, right? And we're talking about making adjustments. And so let's talk about your district for a minute. Sure. A lot of adjustments have had to be made in your district. Talk to us about how you're dealing and navigating with COVID-19.
Sure. So, I mean, from the very beginning and even before the beginning of it hitting New York, I have to be honest with everyone who's listening. I've been following this virus since December, really, when it first hit China, reading about it, then understanding how did it get to Italy, how is this possible, Iran, and just understanding the different ways that the countries have dealt with it. And so what was very apparent to me from the get-go was that, when you compare a country like South Korea to Italy, the reality is that South Korea addressed the issue immediately. As soon as they found out that there was at least one case, they basically shut down almost everything, which is the reason why their curve, how we're hearing about flatten the curve, their curve is kind of like dipping down, the infections are dipping down, whereas in Italy, they waited too long, and that's why we're seeing hundreds and hundreds of deaths and thousands of infections in Italy. And so when it started to come to New York, I was one of the first people inside of the state Senate to basically be ringing that clarion bell, being like, guys, this is not a joke. Okay, it's not the flu. Do not listen to what the president is saying. It's a serious disease. It is deadly if you are over a certain age, if you are over 60, if you have a comorbidity. We have to take it seriously. Also, this is the United States of America. We should be prepared for this stuff. So originally, I was the first Senate office to close down and become digital. I was the first person to request that the Capitol in Albany close to visitors because, as we know, the more people in more close corners, the more likelihood of spreading this illness. Now, also, I want to share with you, I'm a member of the Democratic Senate Conference, so the majority conference. There are members over the age of 70 there. They are the most highly at risk as well, so protecting them. So, from that point on, I was very much taking it seriously. It took a little while, I think, for it to land for most people, to not take it as like, oh, this is a flu. And so as soon as I think everyone kind of locked in as like, oh my gosh, this is serious, what started to happen were these daily calls. And so every single day, what I do because of this is I have my team aggregating all of the information of the day. So what does that look like, right? There are 3 calls. There's a call with the governor's office and the State Department of Health. There's a call with Westchester County Executive and the state and the governor's office. And then there's a call with the New York City mayor's office. Now, there is so much information. If you were just right now to close this call, turn on the TV, look at Twitter, there would be like so much information. You wouldn't know how to organize it. What was even true? What executive order did the governor do today? How do we affect small businesses? So I know that in times of crisis, and having dealt with this as a lawyer during Hurricane Sandy, I worked to recover New York. So I know one of the most important things you can do during a crisis is organize information for people. And so the first act that I took was making sure that there is a daily email update to my constituents. That is the most important thing. It has everything that you could possibly want or need to know about in there. And not only does it have the email of the day, you are able to go back in time to see, well, what happened March 13th? What happened March 14th? So you can see on March 14th, the governor issued an executive order. On March 16th, small businesses get grants or loans, things to that nature, right? So that people are informed, because by the way, there's a lot of misinformation out there. People are spreading misinformation and lies. And the last thing that we need to be doing, because it is actually fatal, is to be spreading, or to be the cause of spreading the misinformation and lies. So that information, and by the way, anybody who's paying attention or is listening to this and really wants to be part of that, I really urge you to sign up for the email. It is simply information. Biaggi@nysenate.gov is my email address. If you want to sign up for it, shoot us an email. We will put you on the list. Additionally to that, what I've been doing is I have been really identifying the issues in my district and writing letters. Okay, so I have probably signed on to and written more letters than I can actually even count at this point. One in particular that was very important to me, because I represent, now listen, the 34th State Senate District is a very gerrymandered district, all right? I have Westchester County, Pelham, Mount Vernon. Then I have the Bronx, I have Riverdale. I kind of curve around like a little bit of a snake. It has City Island, Pelham Parkway. It has Hunts Point, Park District, Castle Hill, and it has Rikers Island. So what does that mean? It means that I have some of the most vulnerable populations in District 34 that need a voice. And when you look at how this virus is spreading, people who are in close quarters, i.e. like jails, are most likely to get this virus. And so as soon as we heard that the first person tested positive on Rikers Island, immediately I issued a statement calling for specific actions to be taken. One in particular, having a satellite testing facility on Rikers Island. There's no reason why we wouldn't do that. We're popping these testing sites up all across the state and city of New York, making sure that there is a continued and immediate release in all the possible cases of the vulnerable incarcerated individuals. What does that mean? It means people who are pregnant, people who are immunocompromised, people who are or have chronic health conditions, people with asthma, other forms of respiratory diseases, and also having a formal suspension of the practice of incarcerating parolees who have violated their parole for technical violations. Why are we putting people in jail for that reason? Especially now, but especially as an overall concept, we should not be doing that. So cut that out. And then also making sure that there's actually medical treatment on Rikers Island. You know, there's a real, and there's several other things that we called for too. But the point I'm just trying to make is that in these times of crisis, calling for and highlighting the places that are the most vulnerable is the only way I think that we come out of this stronger, right? So
let me jump in here, because I want to talk to you about another vulnerable place, which is hospitals, right? I want to talk to you because you got 4 hospitals that are currently under your district, right? How are they faring? And there's also the question about masks, right? I hear the governor say, on one side, we've got enough masks. But then we're watching people who are saying, nurses inside, stories coming back to me personally all around, that we don't have enough masks. What are we hearing from the people on the inside? Because, as I said, you got four hospitals right there at your doorstep.
That's right. So the hospitals in District 34 include Jacoby Hospital, North Central Bronx, Montefiore in the Bronx, Calvary, and then just outside my district is Mount Vernon Hospital, which is also Montefiore, but is very much affected by the people who live in my district. I mean, you know, we're here, to your point, we're hearing we have enough masks, we have enough PPE, by the way, right? Personal protective equipment, masks, gowns, goggles, things like that. We don't have enough, okay? We have a certain amount, we have about 1 million, I think. I'm trying to remember the exact numbers. There's like 1 million certain kinds of masks. You have X thousand number of gowns. Now listen to this, okay? The protocol for a nurse or a doctor is this. Every patient that you see, you're supposed to put on a new gown and a new mask. In this situation that we are in, what I am hearing and what I have seen, especially from the nurses at Jacoby Hospital in the Bronx, is this. They are given a mask and they wear it all day long. They are given a gown and they wear it all day long. So much so that if somebody comes into the ER with a gunshot wound and the blood is on the actual gown, that gown is still worn when they are going to treat patients who have COVID-19. Think about that. That is not only putting other patients at risk, it's putting the nurses' lives at risk. And if you can even imagine having nurses who are infected with this, and then having a whole entire population of nurses not able to actually treat New Yorkers. I mean, it's just devastating. One nurse yesterday reported from Jacoby that they were instructed to continue to go to work even if they tested positive. Can you just imagine this?
Can you say that again? They said if you tested positive,
you still have to come to work. That doesn't even make any sense to me. It doesn't make any sense. And so, you know, here's the real, this is like what's going on, and this is what we're hearing from like the people on the front lines. Here's what we're hearing from the government side, okay? Because I think obviously it's important to just juxtapose, and everyone who's listening can make their own determination of what is really going on here. In order to meet the demand for PPEs, New York is basically crowdsourcing. Donations, they're crowdsourcing from manufacturers. So what does that really look like? What it looks like is a Hunger Games. It's a Hunger Games between New York State and other states competing with manufacturers. It's a Hunger Games between the United States and other countries competing to get their orders in, to make sure that they get the plane there first, filled up with all the equipment. And really, it's creating this market where the prices of gowns and masks, which usually would be, I mean, in the cents, right? Like $1.25 or 60 cents, are $7. So if you can imagine now, you have the prices of these things going up, you have the competition, and really the only person who can actually drive down those prices is the President of the United States by invoking a power that he has, which he hasn't done. And so to the extent that New York is still procuring items, they're working hard to try to get them. The New York City Mayor's office also created this portal for businesses and manufacturers to sign up and partner. We can share that link with you after the show. You can share it with people. I mean, this is not ideal, and it's not ideal, number one, because we were not prepared. Number two, the federal government has not been a friend to us. They refused to release the PPEs that we needed a month ago. You know, when we hear numbers like 500,000 masks will go to the nurses, that's not that many. You have to put into your minds that there are thousands of patients coming through New York City hospitals every single day. So to have 500,000 masks, how long is that going to last for? Not very long at all. And so our reserve needs to be built up. And I mean, we're seeing these amazing stories from people who are basically sitting in their homes or in their factories. You have fashion designers basically sewing just regular masks so people at least have something. But we should not be in this situation as a city or as a state. And so I think that, you know, we don't even have the time to criticize it right now, which sounds even silly. We have to just really act and provide the resources. But when this is all over, we've got to take a real forensic at what happened here.
Yeah. And I want to talk to you too before we get out of here about the budget. I know you guys has got other work doing as far as the budget is concerned for the state. A lot of things are looming right now. We've got the word the New York State is pretty much bankrupt. What are we hearing and what can we expect? And what are you fighting for?
Okay. Well, so I'm in Albany talking to you right now, right? We have about 36 to 48 hours before we vote on the budget, and then we are going to be sent home because obviously, right, everyone needs to stay home. And whoever is watching this, I hope you're watching it from the comforts of your home, that you're not out, that you're actually listening to the guidance, because it really does actually work. So here's what's what, okay? Before COVID-19 came to New York State, the state of New York had a $6.1 billion deficit. $4 billion worth of that was because of Medicaid spending. Now, you could say, well, that sounds terrible. Why did New York overspend for Medicaid? Well, on the one hand, that's true. On the other hand, New York State has 19.6 million residents. 18 million residents have insurance. Now, that doesn't mean they're not underinsured, but they have insurance. And so a lot of those people who have now gotten health insurance have gotten it on the essential marketplace. The essential plan, which is a form of the state's Medicaid plan, is probably the reason why it is the reason why a majority of New Yorkers have health insurance. And so now that's where we were. And at that very point in time, many of us were saying, we got to raise revenue. What does that mean? It means we've got to raise the taxes on the people who make the most, the billionaires, the ultra millionaires. You know, when you look at the tax rate in New York State and California for the ultra millionaires, California's rate, 13%. New York's rate is under 7%. What are we doing? It doesn't even make sense. Let's just tax them in a fair way. So that was one of the things that we tried to push for. Additionally, as a side note, because I think that you probably would appreciate this not fun fact, yachts and jets over $235,000 are not taxed in the state of New York. So like, think about that revenue. Like, there's all these little loopholes, right? But we were really fighting for the millionaires tax. Then COVID-19 comes, and the conservative estimate is that $7 billion of additional deficit. What it really is about $20 billion. So that's where we are right now. Now, put on top of that third layer, the fact that the governor right now is trying to make Medicaid cuts, $2.5 billion worth of Medicaid cuts during a pandemic. What does that mean? State Medicaid funds are cost shared, which means every dollar the state spends, the federal government spends. So a $2.5 billion cut is really a $5 billion cut to the state of New York because of the federal match share. And think about that. Think about cutting that type of money during a pandemic. What it really means, at least to my hospitals, I mean, upwards of $60 million will be cut to the hospitals in my district. How could we possibly, in good faith, with goodwill, say, during a pandemic, while you are risking your lives, we haven't given you enough masks. You know what we're also going to do? We're going to cut the funding to your hospital. It's unconscionable. So I am fighting very hard for that, because what's tied to that, if we make those cuts, which I'm going to be voting no against that, because that is just against everything I believe in. It also means we cut the funding for our public schools and foundation aid funding to our public schools that are underfunded, especially in District 34, $40 million is owed, is just outrageous. So I think we've reached this point in New York where if we don't start getting smart about how we are raising revenue and from whom, we are not talking about hurting the working class, the middle class. We are talking about the ultra wealthy, the people who are always out of work because they don't have to work, okay? They make their money on their investments and their dividends. And there are, by the way, many of them who are actually raising their hand and saying, please tax me. So it's a very difficult time, but I'm fighting very hard. Luckily, I'm not alone. There is a cohort of us that are very loud. And for the people of the Bronx, there is nothing that would bring me more pleasure or joy than to be able to come home and say, we did not make cuts to your hospitals. We did not make cuts to your schools. We made sure that you had everything that you needed to be safe, to be well, and to get through this crisis, because we have your backs. And so that is what I'm committed to. Now, if that's what the governor is committed to, it's very unclear.
All right. Well, Alessandra Biaggi, we want to leave it there. Thank you, Senator, for sharing with us a little bit about what is going on. I think it really puts some things in perspective, and I think it's some things that we really have to watch out for. And as we get closer to the budget, of course, we'll continue to monitor it. I want you to come back right here on the show, give me some more of an update. Let me know what's going on. And certainly we'll stay connected. Thanks for the great work you're doing.
Thank you so much for what you're doing. I appreciate you. Stay safe.
All right, you too now. Senator Biaggi, our guest here on Open. Stay with us. We got more show coming up right after this.
Did you know that brain and spinal cord tumors are the deadliest form of pediatric cancer? They can happen to anyone.
I'm not hungry. My tummy hurts.
You can help us be part of the solution.
Get in here. Hurry.
You can be part of our family.
It's okay.
Please support our mission today. Making Headway Foundation, dedicated to the care, comfort, and cure of children with brain and spinal cord tumors.
The coronavirus continues to wreak havoc here across New York City and in the borough of the Bronx, no different. Every district is really struggling to try to deal and find ways to cope with coronavirus 19. We're pleased to be joined by Councilmember Andrew Cohen, who's the council member of the 11th Councilmatic District in the city of New York. And Councilmember Cohen, good to have you with us.
Good morning. Thank you for having me.
Yeah, great to have you. I mean, we're coming virtually. That's what we do. I mean, obviously, a lot of us have our hands tied, but we're still about bringing content. But talk to us about residents in your district and how coronavirus is actually affecting you so far.
Well, the district, it's kind of interesting in that I have two hospitals. I have Montefiore Medical Center and North Central Bronx. So I've been trying to check in pretty regularly with them to see how they're doing. Believe it or not, I've been calling a lot of constituents, community board members or activists that I know, just trying to find out how everyone's doing and also what they're seeing in their particular corner of the district, checking in at supermarkets, what's going on there to make sure that people have the things that they need. So it's been a lot of that kind of thing.
Yeah. And so the Bronx has its first testing site. Your thoughts on that?
That's also in my district at Lehman College. Last Sunday, a week ago, the governor's office called and invited me to come take a look before it opened for actual testing to see the drive-through site. And it's very, very important that people know that it is by appointment only. Don't just drive up, they will turn you away. And it only slows them down from doing the important work that they need to do. But if you want to get tested and you need to get tested, there's a phone number which is available on my council website through my email or social media. And you can call, and if they'll screen you on the phone. And if they think it's appropriate that you get a test, they'll make an appointment for you, and then you can just drive right up.
Yeah. But it's got to be a good feeling for you, though, being able to have it right here in your district, and then also to be able to be a viable help, especially in times like these where, you know, testing is ultra important and getting people in before doctors so that way they can have that opportunity.
Well, my whole team is working, from home, and I got to say I'm very pleased at how well that has been working. That people have been emailing us, and everybody can get their emails at home. And if you call the office, you leave a message, and we're checking it very regularly, and the messages are getting distributed, and people are getting callbacks pretty promptly, I think. So the constituent service has been, I think, robust. And people are taking advantage of it. And actually, it's nice that the feedback I've gotten is very good from people appreciating. We send out a very comprehensive email listing resources and kind of giving people updates. And we've gotten a lot of good feedback on that. Yeah,
for people who are in your community, obviously a lot of questions continue to come. They're coming to their council member. They want to know some answers. One of the answers, one of the questions that people are asking is, talk to us about alternate side of the street parking, because some people feel like it should be suspended. It is suspended. Some people don't know. Give us the real as to what is going on with alternate side of the street parking.
Well, obviously, coronavirus is a substantial citywide issue now. But a few weeks ago, actually in Riverdale was one of the sort of starting points in connection to a school in my district. So early on, we had been calling for the suspension of alternate side parking, at least in that community board, as people tried to self-quarantine and avoid having contact with other people. We thought it made sense that you shouldn't have to go out and move your car and search for parking. You do it in a snowstorm, and this seems like a certainly bigger emergency than that.
And when we talk about a lot of things the community is having to wrestle with, one of the issues is homeschooling as well. And you've got people who are being homeschooled. There's some in the community that are really struggling with Wi-Fi, but I know that there's some advantages now that are given out, given particularly the situation.
Well, actually, we also had some good news to report at the very end of last week. Altice Optimum is making sure that everybody can get free Wi-Fi now, regardless of your ability to pay or There had been some issue with some people who had outstanding bills. They owed the company money, but it doesn't matter. Regardless of your ability to pay, you're able to access that. And I think the information is also available on my website or on my social media.
That's great. That's great. And seniors, I know they're a big concern. They're the most vulnerable in our communities right now. Many of them are homebound. Many of them have several challenges as well as health challenges. Give us a little bit about how you're able to really take care of seniors and resources available for seniors during this time.
Well, initially, the Department of Aging was using sort of a grab-and-go model for meals. But I think starting today, actually, they've switched over to a completely Meals on Wheels delivery system, so that you don't have to leave your home to get the meal. And I think they're delivering 5 meals at a time, which is really important. We have gotten a few calls that were, very scary. I mean, we were able to get people food, but, homebound seniors or people who were sick, who literally did not have a meal. But now I think that that's up and running. If you're a member of a senior center, I think you're already enrolled. If you'd like to be enrolled, again, I have all the information available on my website, through my email or social media again.
Yeah. What do you want people to know in your district, especially during this time? How you have the opportunity to speak not just to the district, but to the borough about COVID-19?
Well, I will say I'm pretty pleased. I think that the vast majority of people are staying in their homes, really engaging in social distancing. The streets are pretty barren. I'm going to go out again today and just kind of drive around and take a look at what's going on. But my observations are that people are really taking it seriously and doing the right thing by and large. I have some issues in parks. Harris Field has been a little bit of an issue. Seton Park has been a little bit of an issue. But by and large, I really feel like there's been very, very good compliance, and the people I represent are taking it very seriously.
You mentioned at the beginning you have 2 hospitals in your district. How are they dealing, and how are they able to cope? We know that hospitals are pretty much overcrowded, and particularly with people trying to get in. What's the word that you're getting from local hospitals as of late?
Well, I think everybody knows about the crisis at Elmhurst Hospital, but Lincoln Hospital has been in the South Bronx has been pretty hard hit too. So North Central Bronx, which is also a health and hospitals hospital, has been taking some of the overflow from Lincoln Hospital. Montefiore says that they are keeping their head above water, but I think people also have to have expectations. This is not like your routine trip to the hospital. I mean, it's all hands on deck. The circumstances there are very, very tough. It's full, and you should not go to the hospital unless you really need to be there. That's the message I think that we need to get out.
And we're talking about the curve. I mean, the curve is anticipated anywhere between the next 14 to 21 days. And given the fact that the curve is not yet hit, there is a heavy anticipation of how this can actually affect New York City hospitals, with more and more people actually flooding the hospitals.
I'm certainly afraid that we haven't seen the worst of it yet. This is my own opinion, but I'm cautiously optimistic that all of the social distancing, only essential services, essential workers, everybody staying at home, I think that is going to pay dividends, and I think it is going, and I think we're going to see that in the next week or two. Like you said, hopefully this flattening of the curve. But I mean, unfortunately, I'm a council member. I'm not a doctor, but that's, I'm cautiously optimistic, I guess.
Yeah. And what are you hearing from your residents in the community, given the fact that a lot of businesses are closed, a lot of people are concerned about their business and their viability after this? What are you hearing from business owners?
I have spoken to some business owners, and they are definitely very, very concerned. I think that a lot of this is sort of triage, though. Like, if we can't get the virus under control here, and we can't get this curve flattened, businesses are going to be secondary. So I think it's a little bit of one day at a time. We need to get on the other side of this. I think that the city, the state, and hopefully the federal government are going to be prepared to offer assistance to people who really need it.
Yeah. Well, Councilmember Andrew Cohen, thank you so much for taking the time and spending us with us here on Open, letting us know what's going on in District 11. Of course, our thoughts, our prayers continue to be with you and the members of your district as you continue to navigate, as we all do, with COVID-19. Take care.
I really appreciate you doing this. Thanks.
And I want you to stay with us here on Open. Stay with us. We've got more show coming up right after this. And we're back here on Open. Daren Jaime here with you. We thank you for joining us. As always, throughout Open, we've been trying to share with you information and content, particularly as it relates to COVID-19 and how it affects the Bronx and New York City. Joining us now via video virtual interview, we've got Councilmember Andy King, who joins us to talk about what's going on in his district, Councilmatic District 12. And Councilmember King, thank you so much for joining us.
My honor and pleasure, and peace and prayers to everyone who is trying to manage these times.
Yeah, it's a real challenging time. But for you and your district, give us an update as to how things are and what's going on.
Well, I do go out on occasion just to check on the community and make sure everything is fine. People are following protocols. The streets are clean. You go food shopping, people are cordial. The pharmacies are open. People are getting what they need to get. People are wearing masks. Some people are not. A lot of people I've urged to find peace in this time of turmoil and do what you got to do. Be smart for your family, protect your household. More importantly, protect your neighborhood. So in our district, there are some people who are ill. But the best advice that anyone can give is just, if you're not feeling well, do what you normally do when you're not feeling well. Whether it's chicken soup or grabbing something from the backyard and, steaming it and brewing it, or, getting some rest, and follow and practice some of the things that have been advised to us from social distancing and keeping yourself hygienically well. And also what we've done, I got to thank my colleagues in government, but more importantly, thanking the people in Co-op City for their advocacy. And because of the advocacy of residents in Co-op City, myself, Senator Bailey, Assemblyman Deno, Congressman Engel, and Speaker Carl Hasty, today we opened up a drive-through pop-up site located in the Bay Plaza Mall behind the movie theaters. So, people will get an opportunity to go get testing. They're looking at about 200 people a day. They can manage testing there, but you got to go. You can only get tested by appointment.
Right.
And the number for anybody who wants to get tested, or you're going to have to go through a screening process, because they're not just testing you because you want to get tested, because that takes away a lot of resources for those who are actually sick at moving forward in a different stage. So that number for anybody who wants to get tested, and remember, it's a drive-through. It's not a walk-up yet. I have sent the communications to the governor's office in regards to considering how do we deal with those who do not drive, who are in the Co-op City area and surrounding areas. So that call-in number would be 1-888-364-3065. Again, that number is 1-888-364-3065. So please, call, take care of yourselves. More importantly, let's use a little wisdom, and more importantly than anything else, look at prayer. Stay in prayer, and ask everyone, find your sense of peace during this time. It gives us time to reflect, spend time with our families, our loved ones, and now we get a chance to get some home cooked meals if you haven't had a home cooked meal in a while.
Yeah, especially for people on the go or try to reinvent something. But I want to go back to the testing site, because you kind of stole my thunder a little bit, but it's all good.
Oh, I'm sorry, my bad.
It's okay. It's okay. I've had it done a couple times in my career. But look at Bay Plaza for a minute, and look at Co-op City. There are a lot of vulnerable people who are there. So what does that mean for you guys right over in the Co-op City area to be able to have a testing site, considering the fact that you've got a lot of elderly, you have also a population that has, chronic diseases. So it's got to be quite advantageous to have one right in your own backyard.
My response to testing, and while it's a good thing to know if you are with this virus, I would ask everyone, a sense of calmness and logic must always prevail. Even though we were able to establish there is no vaccine for this virus. And if you are feeling sick, whether you're in the Co-op City area, whether you're 65, 75, 85, you should take the same precautions and the same measurements to heal your body. Is it not prudent for you to go outside in this environment? Maybe it's not, if you're not able to move around as fast as you would like to. So, you're going to be, in your home, find that person that you can talk to, your sons, daughters, neighbors, via telephone or whatever medium that you're using. And I think that the testing site offers some relief and comfort to those who are in search of, who are showing symptoms. But if you're not showing symptoms, no matter if you're 22 or 72, then, live within the peace of yourself. Don't claim to be sick if you're not feeling sick. I know they put out there, you can have the symptoms and don't know. Well, if when you're sick, your body will tell you that you're sick. So don't let your mind convince you that something's wrong, because I personally don't, and I choose not to subscribe that everything around me is sick. If I was to do that, my mind would go into the darkest spots on this planet. And I say that to everyone else. Still find love, joy, and peace in your heart, and use the time to reflect and heal.
Yeah. And for you personally, driving around the district, do you find that people are practicing social distancing?
Yes, I watch people as they walk, even in some of the stores we're in. The only place that it can get a little challenging from time to time is when you're the configurations of some grocery stores. And if you get 70 people in the grocery store, 80 people, and the proof of how things play out is that when it's time to check out, I believe the studies say you may be in an average of 25 to 30 minutes in a grocery store, and then on that 40, everybody's at the counter trying to check out. So I think that may be a challenge for folks. But again, if you're not sick and you're not feeling sick, I ask you not to be scared of your own environment, but try to respect the rules of the social distancing and just keeping yourself clean when you touch stuff that you're not aware of, doorknobs, money, where most of our germs are prevalent, to make sure you keep your hands washed, not always sterilizing, but wash them with soap and water, because what tends to do when you use a lot of the hand sanitizer, you end up drying up some of the good germs that protects your skin from bad germs. So it's best to always wash your hands with soap and not always use alcohol-based products to sterilize. Some things can be an overkill that can end up having the reverse effect.
Talk to us about seniors in your district, obviously of major concern, a vulnerable population. What resources are available for seniors, particularly during this time in your district?
Well, the other day we did provide meals to the Eden Wall community. All my nighters are serving lunches, grab and goes in the neighborhood. Co-op City, I was able to secure $135,000 for a breakfast program. So the plan right now is everyone is able to get a meal during the weekend. Even on the weekends, they give them bags to last them throughout the weekend. So we want to make sure that our seniors who can't get out, choose not to go out, they're still able to be fed. So I think that's the biggest thing that seniors were looking for, to making sure that they're able to get a meal. And I'm glad to say that we're doing right by our seniors in our neighborhood. Is there more that possibly can be done? Yeah, but my office and we're staying in contact with folks and just checking on them from time to time to see if they're okay, if they're in need of something. But, we've been resilient as a people. Mm-hmm. And we've gone through a lot of things during the course of time, and it doesn't matter the shade of your skin. You've gone through something, but we know communities like ours have gone through a lot of stuff over the period of time, and we've always prevailed. I'm a spiritual guy. I know Christ is watching us, and all of this is His plan. Nothing is done for accident. So I guess a cleansing was needed, as well as allowing people to reflect back and come back to understanding the spirit of Christ. I don't want to go too far into a spiritual rant, but I cannot sit here on any conversation and not recognize the power and the strength of prayer and the Most High in Christ. So I thank Him to allowing us to bring us closer together. This moment's bring us closer together and talk about agendas and philosophies, and again allows families and parents and children to interact in a more intimate setting that's kind of escaped us as families, as we always working 2 jobs or working 12 hours a day or just running without no sense of direction.
Well, Councilmember Andy King, I want to thank you so much for sharing with us here on Open. Before I get you to go, talk to us real quickly about your youth. A lot of questions have been said about youth in our community, given the fact that some of them are trying to practice social distancing, some aren't doing too well. But you're in charge of some youth as well. I'll give you a final comment to talk about some of our youth and what you're seeing in regards to them.
Well, I think our youth are going through a new trying time. For one thing, when you're our age, we don't necessarily have the energy to always move around, but children are just big balls of energy as it is. So we got to find creative ways to allow our children to understand that this is part of their story and their history by the time they get 40, to tell the story of what was happening when they were 10, 11, or teens. But we ask them all to just take a time, right? This is a time for you to actually do the things that you should be doing, reading, learning, studying, finding a way to interact without always being on the technology that allows you not to socially interact. So I think this is one of those times that allows our young people to sit down and reflect and learn a little bit about truths from yesterdays. I have a granddaughter who, the school system is trying to do its best to put together, to keep some education flowing. But, I've always said education learning doesn't always happen in a school building. Your greatest education and learning happens is what you do when you leave a school building. So now everyone has, so right now it's time for people to jump into that 100%, our students to jump in 100%, and then parents can learn what their kids are learning, so you can have a conversation that exactly what your child is learning. So I don't look at this whole thing as a horror story. There are all some positives that have come out of it. So I just ask us to look at this glass as half full as opposed to as 3/4 or 89% empty. So.
All right. Well, Councilmember King, we'll leave it there, and that's good wisdom to do. Councilmember Andy King of District 12 here in the borough of the Bronx. Thank you for taking the time to share. Be well, be safe, my friend.
God bless. God be with you and your family as well.
Same here. All righty. We got to leave it there. Come back with more open. Stay with us. We're coming right back right after this. Welcome back to Open. I'm Daren Jaime, and thank you for staying with us. We continue to bring you a show that's filled with virtual content, making you aware of all the things and even opportunities and resources amidst COVID-19. And we want to introduce you to a very special organization that's also making a difference in the midst of COVID-19. And I'm pleased to introduce you to Ms. Jheri Hardaway. She is the owner of Ms. Jheri Worldwide, and we're glad to have you, Ms. Jheri, being with us, and thank you for sharing.
Thank you. No problem. I hope you're safe and healthy and well.
Yeah, we're trying to do the best we can, and I hope you are too. And certainly, I know a lot of us are, making adjustments during this season. But tell us a little bit about Ms. Jheri Worldwide, and for people who don't know.
Okay, so I've been working in education for about 10 years. And I'm actually trying to reform education. I've been a substitute since I was in college in North Carolina A&T, and I'm going on to sub and do other things in schools around the country. And what I was working on before the quarantine was a platform, television or online platform that would take children outside. Right? So literally the opposite of what's happening right now. In our pilot episode, the students had 3 learning journeys. They designed a sneaker, they learned how to make guacamole, and then they sat with a rapper and learned about multi-syllabic rhyming. So the whole concept was each episode was a location base where the students encountered these 3 challenges that we call learning journeys, and they, learn about each other, they grow together, and they just have a good time outside of their normal environment. So now that entire concept has been flipped on its head, I'm in the online learning space. We've all had to adapt our various businesses and pursuits that we're working on. And so what I'm doing is working to bring more innovative solutions to online learning.
And so when we talk about online learning, obviously a lot of students nowadays are really trying to deal with that, right? How to adapt to online learning. But this is something that you're kind of ahead of the game with, because you really were introducing students to this concept before this whole thing happened.
Mm-hmm. Yeah, it's just really one of the things that I started to notice when I would go to different schools around New York is that, a lot of schools were put the phone away, close the computer. But really, we can teach young people how to use those tools to help them improve. So for example, I'm teaching with iUrban Teen. I'm teaching an entrepreneurship in evolving times course right now. And one of the things that we do is anytime there's a word in the text that they don't know, we can automatically click on it. We can look it up. I'm sending them links. I'm like, okay, check this out, watch this video, read this. So it's almost like we're utilizing the internet in a way that it really wasn't as effective in classrooms because of things like behavior management and because of things like that I don't really deal with as an independent educator, things like testing and data and all the stats. So I'm interested to see how the curve goes because, we're on week 2 and there are teachers that might not have been strong in the classroom that might not be strong online either. So I think that the situation and what I'm excited about is being that solution and being like, you know what, your kids got to log on with their teacher from this amount of time. Well, look at these options, right? And I'm also putting a program together to where on Mondays and Tuesdays, I'm going to post content on my websites that families will be able to get on Instagram Live on Friday evenings. And we're going to have conversations with the whole family, the kids, the parents. So one of our first conversations, the movie Claudine, is actually on YouTube for free. So pushing that movie out, people are watching it, and then we're going to facilitate that conversation on IG Live on Friday night at 8 p.m. Eastern.
And I want to talk a little bit about your international experience. You went to school internationally too, and we know that. And you also have this, she's the author for Meat for Cheese and Chocolate. Talk to us a little bit about that.
So I wrote 2 books while studying abroad. I wrote Meat for Cheese and Chocolate while I was studying diplomacy and social justice in Switzerland and surrounding areas. And then I wrote Meet for Tea in London while I got a master's degree in creative writing in London. And more than anything with this going on, there were times where even my parents were like, are you sure you're going to go there? You got to take out loans, you got to do this. And I'm like, man, I have to have this experience. Even when I was in London, I got an internship at London 2012 and ended up at the Olympics, So I'm so glad that I took those chances and just went places because now I'm 24 countries in, and we're seeing people close up their borders. I'm hoping for the best, but at the same time, like, all this time has allowed me to reflect and realize how grateful I am for all the blessings and opportunities that came my way. And I'm grateful to myself for taking advantage of them, because sometimes I talk to students and they're like, oh, I do a lot of college prep and a lot of like one-on-one tutoring, which I'm still doing online. And, a lot of students tell me about, I'm scared to do this. I'm scared to go there. I'm scared to leave my parents. And I'm like, but when you leave, you actually take your whole community with you because you come back and bring those skills. So, hoping for the best, and I'm hoping we come out of this on top, and I can encourage some other minorities to, take their talents elsewhere as well.
Yeah, I want one last thing before we get out of here. I want to talk to you a little bit about your fight for equal rights, because I know you're much an advocate and you're a voice for that. Talk about the fight that you have for equal rights. So when it comes to equal rights, one of the things that I feel like we're dealing with right now is an issue with access to internet. Right? Even the last school that I visited was Monday before last, and we were giving out Chromebooks. But the follow-up question is about Wi-Fi. So the digital divide is real. iUrban Teen, that's one of the things that whole platform is about, is bringing STEM resources and just tech resources to children in underrepresented areas. And, I think that online education, that's a direction that we're actually going in. So there's going to be some, I'm sure, high schools that are going to become accredited to be able to teach online because our world is changing. So I think that we have to be in this space where everyone has access. I saw, I think it was the mayor in Coachella had put Wi-Fi on buses and would drive the buses around so the students would have access. We've got to find ways to make sure that everybody has access, or else we're going to be looking at a long-term trajectory with the same type of people in the positions of power because they're the ones that have access to the information and resources. Well, we want to thank you for coming and sharing with us a little bit about what goes on with Ms. Jheri Worldwide. Certainly, if people want to get connected to you, how do they do that before we leave?
So everything's the same. It's Miss Jheri Worldwide, spelled MSJHERI Worldwide. You can find me on any platform. You can go to Instagram. I got the link tree to all the other, to the information I'm talking to you about, and then the website, MissJheriWorldwide.com.
All righty. Well, thank you so much for sharing with us, and certainly want to make sure that people get connected to you. You're a great and valuable resource, especially during a time like this. Thank you so much, Ms. Jheri.
Thank you. I appreciate your time.
All righty, Ms. Jheri Worldwide, Gerry Hardaway, the owner of Ms. Jheri Worldwide. Please stay connected to her. You find out her information, as we said, Facebook, Twitter, Instagram. Get connected. And definitely, if you're trying to navigate this online platform, and for many people, it's new and there is this huge digital divide, a great resource for people to tap into. Miss Jheri Hardaway, thanks much.
Thank you.
All right, stay with us. We got more open. We're not going anywhere. We're coming right back right after this. And we're back here on Open. Daren Jaime here with you as we continue our coverage of breaking news, information, and content with things concerning COVID-19, particularly Bronx businesses. How have they actually been affected by COVID-19? We have one business in particular that we want to highlight and bring to you as we share a little bit about how COVID-19 is affecting them, but not only how it's affecting them, but how they're using their business to really be a blessing unto others. So we're here talking with Hector Trinidad. And Hector, good to have you. He is the manager of Lexa Bar and Garden. And Hector, great to have you.
Thank you.
So give us a little bit about Lexa Bar and Garden and talk to us about like how COVID-19, because we know the restaurants and businesses have pretty much, shut down except for takeout. But talk to us about how this has affected you.
Well, it's affected my business in the sense that I usually work with 15 employees on a weekly basis, and they're all currently unemployed. I had to let go every single one of them. I'm currently working here by myself, taking all the orders, takeout orders, just to maintain the business open, try to keep the doors open until this is all over. It's taking a toll on myself because I'm here working every single day from 1 p.m. to 9:30 p.m. And basically, I'm here by myself, just dealing with all the takeout orders. Sometimes it's positive, sometimes it's negative. We're here, we don't get any orders at all, but I'm sticking it through. I'm trying to make sure that our doors are open once this is all over with.
And so, that conversation of having to lay off your workers, I know that had to be a heavy one. How long did it take before you got to the place where you said, guys, we're going to have to put a pause on this?
The things we've been hearing on the news, and once the governor announced that all non-essential businesses will have to reduce down to 50%, 25%, that's when I had to talk to my employees. And I basically told them that it wasn't beneficial for us to have them here, not only financially, but for their health being. So I basically said that I will have them on a week-to-week basis notice as to when they come back. And we haven't heard anything from the governor or anything. The situation keeps getting worse and worse. So I haven't been able to reach out to them and tell them any positive news as of yet.
Yeah, we know it's going to be a long, it's going to be a long time for a minute for a business to be able to get back to any semblance of business as usual. But talk to us about that, because given the fact that you're not business as usual, you've had to make these cutbacks and these adjustments. Obviously, the financial component is a major component. Have you been able to talk to anybody from government or organizations that are saying that there might be some help for you, given the fact that you're in this situation?
I haven't spoke to anyone at this point as of yet. I'm hoping that we get some information leading to it. But honestly, I haven't spoken to anyone. I'm hoping we get some information in the mail or some type of correspondence or anything that will help us. I looked online in regards to unemployment for most of my employees. Basically, since they're 1099 self-employed, I think they're going to have issues filing. So it's going to be a problem on their end. On my end, I always file every year, so I might not have an issue with it. But my employees are going to be very affected by it.
Yeah. I know the Bronx Chamber of Commerce is a great resource, and hopefully maybe you get a chance to have some conversation with them. We were on the show the other week and they said if there's a business that has some questions or needs some assistance, to definitely contact the Bronx Chamber of Commerce. And so if you don't have their information, of course, we'll be glad to connect you with them, so you can be able to have that resource in your toolbox as well. But talk to me about customers. What are customers saying as they're coming through to you?
Customers basically walk in, they feel disappointed in a way, like, well, we can't believe it's can't come to this, where there's no one in the business, just them walking in, requesting something to eat. And I tell them they have to wait till I make the food. Sometimes they have to wait 10 to 15 minutes because I'm by myself. And basically, they're in disbelief of everything that's going on. They can't believe that we've gotten to these measures where social distancing and no one is around, all the businesses are shutting down one by one. And there's very few in the neighborhood where I work at. There's only very few, only the essential supermarkets and pharmacy, and only 3 to 4 takeout businesses left. Everyone has closed down one by one.
Yeah. Well, we know your doors are still open. I'm talking to Hector Trinidad, manager of Lexa Bar and Garden. And for people who don't know about Lexa Bar and Garden, Hector, why don't you tell them real quick? And I also want you to get into this very special, if I say the word mixta, what does that mean?
Mixta is it's a dish that we created where it's plantain with what's considered ceviche, a mixture of ceviche with chicken on top and guacamole. It's like a Spanish tradition dish where we serve our customers. If an order comes with 5, it's like an appetizer, but it's really good. It was one of our top picks when it comes to serving our customers.
Yeah. And so we want people to know, there are some restaurants that are still open and open for business. Lexa Bar and Garden is definitely there. Hector Trinidad is there. And you're running a one-man show. Hector, was there ever a time where you ever thought, I might have to do this all by myself? Did you ever think that?
No, I never even dawned my mind that I would have to be doing this alone.
Yeah. Well, just know that you're not alone. And there are a lot of businesses that are suffering and struggling just like you. And certainly, as we said, we'll do the best job that we can to connect you with some resources to help you to navigate through this, because this is unprecedented. I think a lot of people never saw this coming at all. And for the people that did see this coming, I don't even think they predicted the magnitude of what we'd be seeing here today. So continue to keep up the great work. I'm going to give you one final word that you can get to share with Bronxites. So let Bronxites know what you want them to know.
Basically, we're here to provide a service. I'm here to serve anyone. Any essential workers could come in free of charge. I'm not going to charge any essential workers, and thank them for all the services that they've been providing to keep our city going. I'll be here to serve anyone. Just feel free to stop by or just call. We're serving food through Uber Eats or just takeout deliveries. So give me a call. I'm here.
That's right. We want to let people know. Hector, that's a great thing that you're doing. Even with your business and the challenges that you're facing, you're still giving back and giving out to the community. And Hector Trinidad, manager of Lexa Bar and Garden. Before we go, somebody's watching saying, listen, where are they located? You tell them once again.
We're located at 357 East 204th Street, Bronx, New York, 10467, corner of Decatur Avenue.
All righty. Hector, good to have you. Best wishes. And definitely, if you need some resources, we'll connect you to it. And stay strong and stay encouraged. And most of all, stay safe.
Thank you. Likewise.
Well, we come to the end of our show today, and I'd like to thank all of our guests for joining us. But most of all, I want to thank you, the viewer, for tuning in. Now, if you missed any part of today's show, you can catch the Recablecast at 5 and 10 p.m. on Bronx's Channel 67, FiOS, that would be Channel 33, and of course, anytime on the web at bronxnet.org. For all of us here on the set of Open, I'm Daren Jaime saying take care, God bless. Rena Valentine will be coming to us on Friday with a brand new episode of Open. Until then, stay safe, stay indoors, but most of all, stay encouraged.